So today we're going to be responding to these tweets by Richard Dawkins posted on the 21st of September. He writes, "You can argue over whether masks, hand washing, banning groups, etc. are effective. What you cannot argue is that you are personally entitled to take the risk as a matter of individual liberty. You risk other lives as well as your own. It's just elementary epidemiology." And the second tweet, "You can argue, wrongly, that the risk to others is small, just as you can argue, wrongly, that the risk to others from drunk driving is small. What you cannot argue, as many right-wing idiots in effect do, is that personal liberty is the only consideration that matters." Okay, Richard, so there are politicians, medical spokespeople and media talking heads making the claim that based on their evidence, COVID is so dangerous that it justifies the curtailment of individual liberties. There is a cost-benefit analysis to be done here, clearly, because there are significant negative repercussions and consequences to individual physical and mental health, to the economy, and to society in general from the COVID restrictions themselves. There are negative long-term side effects from masks, social distancing, prolonged isolation, delayed cancer treatments, destroyed businesses, job losses, people falling into poverty, etc. Is the virus so deadly that it justifies the consequences of these mitigation measures?
And my head I'd be scratching while my thoughts were busy hatching if I only had a brain.
Are these measures sustainable long term? The burden of proof as to the severity of the illness and responsibility to justify the restrictions on individual liberties is on those making the claim. When you say the following in your tweet, what you cannot argue is that you are personally entitled to take the risk as a matter of individual liberty. You risk other lives as well as your own. Firstly, I can argue whatever I want. Thank you very much. But basically, what you're suggesting, Richard, is a recipe for people never being able to leave their homes because they might get someone somewhere killed unintentionally. It's clear from the fatality data that COVID is no more deadly, perhaps even less deadly, than the flu. This virus is clearly not Ebola. People are not dropping dead on the streets of London, for example. There's no mass graves. Funeral homes aren't struggling to keep up with the demand. We're not hearing the sirens of ambulances non-stop throughout our towns and cities. Hospitals are operating at reduced capacity. ICUs are not overrun. The vast majority of people don't know anyone who has it, let alone anybody who's died from it. There is nothing out of the ordinary when looking at monthly death numbers for 2020 when compared to previous years. In fact, here in Ireland, a country with significant COVID restrictions, more people died in the first 5 months of 2018 than in 2020. This is an overblown hoax of the highest order. The deadliness of the virus matters, and therefore the restrictions on individual liberties should be in direct proportion to the level of the danger. It's been clear for several months now that this is not the case. How many times have you gone about your day with a cold or flu and passed it on to someone else who passed it down a long chain of people until it reached somebody elderly somewhere in a nursing home, and this resulted in them dying? This may have happened many times throughout our lives, and we'd have no way of knowing. This is a natural part of human existence. We don't intentionally wish harm on others, but we also must accept that death is a part of life.
Death is a natural part of life. Mourn them do not, miss them do not. Attachment leads to jealousy.
Therefore, vulnerable people should decide for themselves if they wish to quarantine and take precautions or not, but the choice should never be taken away from them. In my opinion, the vulnerability of elderly people is being weaponized by the government as an excuse to take away the rights and freedoms of the rest of the population. Surely we must strive to actually live life in the world in a meaningful manner and not to simply exist in permanent imprisonment because we're crippled and paralyzed by the fear of negatively impacting upon somebody else. That's just pure neurosis. Life carries with it a certain degree of risk, and people should be permitted to decide for themselves if they wish to take that risk. What you're suggesting, Richard, is that people's individual liberties are selfish. Also, Richard, in your second tweet you say, just as you can argue wrongly that the risk to others from drunk driving is small. We don't have to talk about drunk driving, Richard. Driving a car sober is a risk by itself. Road accidents happen all the time, and road deaths happen on a regular basis. Most of them happen without a drop of alcohol being involved. If we apply your logic about masks and hand washing and banning groups and other such measures, for example, by that logic, your right to drive a car should not trump a pedestrian's right to not get run over by you.
Because there's a risk that you could kill someone every time you get into your car, right? So therefore, ban cars? You see, I can do this as well, Richard.
This was Britain in its darkest hour. The people knew they were in for the worst the Nazi mind could invent, yet they didn't panic or run away. They patrolled and waited. They drilled and waited. They worked and waited. Waited for the terror they knew was coming. Then it came. That's the sound that became part of the life of every man, woman, and child in Britain.